Reporting for the Augusta Free Press, I'm Chris Grahan. Brian Moran was in Waynesboro Friday afternoon to talk with voters about a proposal for improving access to health care for Virginia children. Moran is a candidate for the Democratic Party nomination to run for governor this fall. The nomination will be decided in a June primary. A group of about a dozen local voters met with Moran at Chickpeas in downtown Waynesboro. Let's hear from Moran on his Cover Every Kid plan.
We have 200,000 kids without health insurance. Now, we now have a leader, a president, thanks to many of you. And the last time I was here in Waynesboro, I was with Chris at the Barack Obama office here in Waynesboro. But we now have a leader, a president, who understands the need for health insurance and who will do his very best for universal health insurance. I look forward to partnering with him to accomplish that. But there are things here that we can do in the area of health care, providing more accessible health care to more Virginians. And I want to get going and working on those issues. First of which would be children. As I mentioned, 200,000 children go without health care right now. No parent should go to bed at night worrying whether or not their child will become ill and whether or not there will be health care to address that illness. I have, very personal to me, I have an 8-year-old and a 6-year-old at home. And it's very important to me. Now this is an area that's not only a moral obligation, but also one that's an economic necessity. Because healthy kids grow up to be healthy and productive adults. This is just a smart investment in our future. So how do we get those 200 kids in the health care? First, we increase the eligibility for S-CHIP. The federal program is called S-CHIP. The president now has expanded S-CHIP eligibility. I want to take state action to leverage those federal funds. I would raise it from the 200% of federal poverty level to 300%. Then those families who are not eligible for the 300%, allow them to buy into our program at affordable rates. Third, I want to eliminate the waiting period. There's currently a 4-month waiting period for those families who are losing their health insurance and waiting 4 months to be able to become eligible for our state program. Particularly today, when so many families are losing their jobs, I want to eliminate that unnecessary 4-month waiting period. Fourth, automatic enrollment at birth. If the family is eligible for FAMUS, Children's Health Insurance, have automatic enrollment at birth and eliminate the delay in enrolling that child. That can enroll 100% of our children in health care. Second, seniors. You know, we have a booming generation of booming population in the senior category. Next year, 20% of our population will be over the age 60. Now, I don't consider that senior, trust me, I'm fast approaching that, and I think 60 is vigorous and young. But that is an area in which we need to start preparing for an aging population. And we can do that by making now financial incentives for long-term health care, making it more affordable, providing incentives for people to start enrolling in long-term health care insurance. Second, there's a very long waiting list now for in-home meal delivery. And we should be able to eliminate that waiting list, because what ultimately I'd like to do is be able to have seniors age with dignity and comfort in their own home. You can do that by increasing reimbursement rates for personal care assistance, which frankly it's more comfortable, but it's also cheaper as a society to allow them, seniors to age at home and providing them the services necessary to do that. So we plan on accomplishing that as well. Third, working parents. Again, this is an area we're falling behind. I want to get us increased Medicaid eligibility to the national average for working parents. There are so many families right now who are working and they're barely staying above the poverty line. Paycheck to paycheck they're living. They can't afford health insurance. And if you increase the Medicaid eligibility to the national average, we can enroll more families. Now, we're 47. Virginia's 47th in the nation in that regard. We can do better. We must do better. Finally, I want to enroll more young people in our health insurance pool. Right now, at 19, you're prohibited from staying on your parents' policy. We can raise that to 26. It does a couple of things. One, it provides health insurance to young people, but two, it enrolls more healthy adults, young adults, into our health care pool. Thus, the more healthier people you have in the pool, the rates come down and make health care more affordable to all Virginians. So that is a sense that it's fiscally responsible, also provides insurance to young adults. So that's a method by which we can do it. And I want to talk a little bit about small businesses too, because we chatted with this young lady who has a small business next door. I have a small business. Before I started running for governor, I actually worked for a living, and but I had 12 employees. I provided health insurance to my employees. Not all small businesses can afford to do that. I want to work to make sure that small businesses can provide health insurance to their employees. I served on Governor Kane's health reform task force. And one of the issues with respect to accessibility and affordability had to do with small businesses. Those individuals ages 18 to 35 do not have health insurance because primarily they work for small businesses who cannot afford it. Two, they're the healthiest among us. So again, it is a fiscally responsible, an incentive, fiscal incentive to try to get them into the health insurance pool to make health insurance more affordable for all of us, because they are the healthy ones, and we need them in the pool paying into the system at more affordable rates. So we can help pool our small businesses and provide health insurance. And as you pool, you're more competitive. You pool all your smaller businesses so that you can go out in the market and find a health care plan that's affordable. The governor proposed something, I sponsored it last year, to try to provide more small business health insurance. We talked about a third coming from the state, a third coming from the small business employer, and a third from the employee, and creating a market for insurance companies to provide the affordable health insurance to small businesses. So that's an area in which I want to pursue. So this is an area, there's a number of issues that are important to the Commonwealth right now. Strengthening our economy, creating jobs, extremely important. And I think healthcare, providing more healthcare options to more Virginians. There's 1 in 7 Virginians without health insurance right now. It's unacceptable. 200,000 of our kids go without health insurance. That's unacceptable to me. So healthcare will be one of my top priorities as governor of the Commonwealth, and I look forward to working on those issues to do that. Last week, I was talking about energy, the economy, and our environment, that we truly can reject the false choice between growing our economy and protecting our environment. I'm convinced we can reject that false promise. We can create green jobs and protect our environment at the same time. With respect to health insurance and health care, we can expand options and affordability and accessibility to more Virginians, and particularly now that we have someone in the presidency that will have the bully pulpit and the federal government. I look forward to partnering with him to provide health insurance to Virginians. This plan here is something I know I can accomplish. I've been serving 12 years in the legislature. I know I can get these things done. We can have some tangible results so that 4 years from now when I return to Waynesboro, have we insured every single child? Yes. Do seniors have a better quality of life? Yes. Do small businesses have the access to insurance pools? Yes. And so these are things I want to accomplish, and I look forward to getting to work.